Hey guys, my name is Maggie Bashirs. I'm a licensed counselor at White River Medical Center in Batesville. I work in our adult psychiatric unit called the Stepping Stone, and I also work at White River Behavioral Health Clinic, our outpatient clinic. I think we can all agree that this is a very different time. I know for me and most people that I've talked to, a lot of people are feeling anxious, maybe feeling fearful of maybe the what ifs, what are, the unknowns. And then also feeling overwhelmed and just not really sure what to do and how to cope through these times. I think it's still very important to check in on each other. Obviously by social distancing and following the CDC guidelines, but to call a friend, check in on a loved one through FaceTime, get on social media to touch base with those loved ones. That's still very, very important during this time. But also taking the time to make sure you're okay. Take the time to check in on yourself. Again, feeling anxious, feeling overwhelmed, those are things that we have to continue to cope with. And by coping, it's sometimes difficult because some of our coping mechanisms might be hanging out with friends, being with loved ones, going out, trying not to isolate. And so we're having to adjust coping during this time as well. And so one coping skill I like to use is to practice mindfulness. And mindfulness just means to be in the present, be centered within yourself. Take the time to take that deep breath and gather your thoughts. It doesn't mean to stop your thoughts, but it does mean to be in the moment and think about the present. And so one technique that I like to use with mindfulness is called the grounding techniques. And so I would ask that you put your feet flat on the floor. I'd ask that you take a deep breath. And you're going to use your 5 senses through this technique. You can do this in any order and really any way that can help you feel more at peace and more calm. And so now I'm going to look around the room and think about 5 things that you might be able to see. And be very, very specific with what you see. And you can name these things out loud. You can think about them in your head. I know for me, when I name them out loud, it makes it a little bit easier for me to focus and really concentrate on what I'm talking about. So if you're in the living room, you might see a lamp. Be very specific with what that lamp looks like. What color is it? What does it feel like? How bright is that lamp? And so do that with 5 different things that you might be able to see wherever you're at. And this is a coping skill that you can use anytime, anywhere, and you just need yourself. And so then you can go down to 4. What are 4 things that you might be able to hear? If you're outside, you might be able to hear cars go by. You might be able to hear your neighbors. You might be able to hear the birds chirping. And so again, be very, very specific when you're naming those things that you can hear. And then what are 3 things that you might be able to smell? Again, if you're in your house, you may be in the kitchen, you might be able to smell dinner cooking, or you might be able to smell the laundry going. So just be creative and think about different things that you wouldn't normally think about unless you were actually, focused in on those different things. And then 2, what are 2 things that you might be able to, feel, be able to touch? I like this one because you can really focus in on what are things around you that you can actually touch. What are the different textures? What's that like? Is it smooth? Is it rough? Is it, sharp? Is it, what color is it, and so forth. And then what is one thing you might be able to taste? I don't recommend just putting anything in your mouth, especially during this time. But you might be eating dinner and be able to say, what can I taste? What does this food taste like? And actually really think about it. And so, like I said, that can be done in any order. It can be done with anything, any room that you're in, but it really does take concentration and focus on what you're actually talking about. And so that's just one maybe helpful technique. I know for me, when I get anxious, if I'm really focus all of my energy on those 5 senses, then it can help you take that step back to say, okay, I'm calm. now we can move forward with what we need to do. And so again, that's just one way to cope. It's one way to cope on your own, and by practicing that social distance guideline. And so again, I just encourage you to check in on yourself. I encourage you to check in on others, but if you can't take care of yourself, it's really hard to take care of other people. So make sure during this time of heartache and confusion and frustration that you're really taking the time to practice self-care and managing your own emotions. And so stay safe, stay home, and I look forward to seeing you.